Okay, Chapter 39, Antibiotics, Part 2. Oops, let me get back here. Okay, multi-drug resistant organisms. This is a list of the antibiotics that, the organisms that are really having problems with being treated because we have so many antibiotic resistance to them. And again, that's just because of people we're using them too much for when we don't really need them, and also when people are not completing their full dose. These bacteria get really strong and are resistant to some antibiotics that actually they used to be very, very sensitive to. All right, so that was just a list. That was VRE, MRSA, extended spectrum beta-lactam bacteria, and the carbapenem-resistant endobacteria. So you'll hear that. The most prevalent ones are the MRSA and the VRE. All right, so now we're just going to talk about a few miscellaneous antibiotics that are out there that are used most frequently. So one of them is aminoglycosides. These are very, very potent antibiotics. They work very well for gram-negative bacteria. So if you've had a trauma or anything like that, these are used very, very frequently. And then again, we like to kill with the gram-negative. The problem with it, there's two B's, nephrotoxicity and ototoxicity. And so it can damage the 8th cranial nerve, and that hearing does not usually come back. And also the nephro damage can be acute renal failure, but if the patient's kidneys don't recover, usually they recover in 6 weeks, but if they don't, they may have to be on dialysis. So we have a lot of respect for these drugs, and because we know they're can be very toxic, we do drug levels. So we'll do gentamicin troughs or peaks just to make sure that the kidneys are clearing the drug and that we're not getting a dose that's too high. The quinolones, these drugs are absorbed very well orally. So there's a lot of Cipro out there that's given for various types of infections. So if if the patient's taking other medications, they should really, you should look and see if there's any interactions with them, and then they should give the drug separately, like half hour after the dose. An hour after the dose is better. And then if we have patients on enteral tube feedings, we generally hold our tube feeding for a half hour before we give the drug, let the stomach empty, and then after we give the drug, we still wait another half hour so the drug will have time to absorb. There's interactions with dairy products, oral anticoagulants, and probenecid and nitrofurantoin. And again, used for various types of infections. All right, during IV quinolone therapy in an 88-year-old, what potential problem is of most concern? Well, this answer is tendon rupture. So that's been a black box warning, and so we use this drug very judiciously because of that problem. And sometimes, tendons are very, very hard to heal when they rupture, so they may cause some further disability if that does happen, especially if you're 88 years old. Other adverse effects are listed, and you can take a look at those. All right, then we're going to talk about a few more miscellaneous antibiotics: Cleocin, Zyvox, Flagyl, Macrodantin, and Vancomycin. And then the generic names: clindamycin, Lizolid, metronidazole, nitrofurantoin, and again, vancomycin. So Cleocin we'll start with first. It's a very popular drug. It's used, again, pre-op a lot for deep tissue perfusion, kind of like our Keflex. And it works in many different areas, and so docs like it because of that deep perfusion. It can cause a colitis, and also has been known to be associated with causing C. diff, which is a chronic diarrhea that has to be treated with more antibiotics. And linezolid, this is a drug that we use to treat one of those resistant bacteria, the VRE, vanco-resistant enterococcal. So that's what's nice about this drug since it's came out. And then it can cause some problems with hypotension and reactions with SSRIs, so that would be something to be very aware of because a lot of people are on the SSRIs for depression. And any food reactions with tyramine foods. Remember, those are the ones that we don't take with the MAO inhibitors as well, and the tyramine-containing foods. Okay, Flagyl, very popular drug, and it's used for a lot of gynecological infections, and it's used for intra-abdominal surgery and intra-abdominal trauma, and it is a anaerobic metabolism. I mean, it's an anaerobic antibiotic, so it works for those anaerobic organisms that grow in your gut. And also can be used for protozoa infections. And then the macrodantin, we use that for various infections, UTIs, E. coli, and we have to make sure we monitor our BUN and our creatinine very carefully because of the problem with the potential renal dysfunction. But also this is used for urinary tract infections just for the reason that it does concentrate itself in the urine and helps get rid of bacteria in the urine. So it's very specific for the UTIs. And also we need to monitor the liver function tests. Then we've got Vanco, another very popular drug because it is a drug of choice for MRSA. And remember I told you how prevalent it was out there. So we can take it orally, and we also give it intravenously. If we give it intravenously, we monitor those blood levels, and we make sure that, again, the kidneys are clearing the drug and that we are not causing that BUN and creatinine to increase. And this drug can cause ototoxicity and nephro, so a little bit like the gentamicin, tobramycin. They can cause ototoxicity and nephrotoxicity as well. And we do blood levels on them too. Okay, question. A 58-year-old man is receiving Vanco as part of treatment for severe bone infection. After the infusion, he begins to experience some itching and flushing of the neck, face, and upper body. He reports no chills or difficulty breathing. The nurse should suspect allergy, anaphylaxis, or the med will not be effective for bone infection. Well, when you get that severe itching and flushing of the trunk area and the neck and face with vancomycin, it's called red man syndrome, and that usually means you need to slow that medication down. It's been infusing too fast, and it's just a reaction that patients will have if it's infused too quickly. It's usually given over an hour. All right, if they do develop flushing and itching, then what we can do, because if they have something like MRSA and we want to get rid of the infection, Vanco we know is the best thing. So we can order Benadryl, which is an antihistamine that we learned about, and that will help decrease those symptoms of the flushing and the itching. All right, and again, make sure that your infusion goes over 60 minutes. All right, and nursing implications for this chapter are the same as the chapter 38, so please review those before you take your exam. Thank you.